First, I would like to ask your permission to use this video for educational purpose on the internet. Now, tell me, before the surgery, our surgery was done almost a little more than a year ago, correct?
Yes.
Now,
actually, I think it was August, wasn't it? August 22nd?
Oh, so it's not even a year ago.
Yeah, hasn't even been a year.
Yeah. Now, what were your symptoms before the surgery?
Oh, very painful on the buttocks, sciatic nerve, or whatever, on both sides.
Yeah.
Sometimes it would shoot down the leg.
So
it's hard to walk much more than 10 feet, really.
10 feet? You couldn't walk even 10 feet now?
No, without it hurting.
Without hurting, yeah. That is, we have a name for that. We call that claudication. When you walk, pain gets worse and make you stop. Now, pain in the legs. Where was the pain in the legs before the surgery? Show me.
Well, it was mostly the back. Most of the pain was back and it shoot down.
1 to 10. How bad was that pain before the surgery?
It was probably a 10.
It was 10.
Yeah.
Okay. Now, our surgery was actually my note says it was just about a year ago.
Yeah.
7/22/21. So today is 7/8/19/22.
Oh, okay. I thought it was August. Maybe it wasn't.
Yeah.
No, that makes sense. July. Yeah.
Yeah. And this is what we did. We did a 2-level fusion, where we literally took the bottom 2 discs out. You see, there's lots of bone spurs there used to be, and your spine was as well a little side bending, but these are the screws that we put in, the 2 spacers. Everything is good, and bone is actually pretty much growing okay. Now, and that surgery that was done about a year ago, it took us 46 minutes skin to skin. You stayed 1 night in the hospital, and our blood loss was 22 cc, which is less than 1/10 of a cup of coffee. So do you remember the surgery?
Yes.
When did the leg pain go away?
Oh, maybe after surgery.
Yet you woke up and the leg pain was gone?
Well, I really knew it was gone when the nurse first got, up post surgery for a walk.
Yeah.
And you start walking, and then it hits you that, oh my God, pain's gone.
Pain's gone, okay. And the back pain, when did it subsided and you start feeling less back pain? When did it, how long did it take?
Post-op?
Well, after the surgery, yeah.
Back, that probably took a little bit longer. It was almost a year ago, so
so it's hard to remember.
It's hard to remember.
And it's a good thing that you don't remember that. That means that is in your past, not daily activity, how long after the surgery did you start taking care of yourself and doing daily activity? How many days or weeks did it take you to do that?
I'm going to say at least a couple of weeks.
Couple of weeks, yeah.
Where you feel, because you're really laid up right after surgery.
Yeah.
You just had surgery.
Yeah, absolutely. So a couple of weeks.
Yeah.
Now that is usually, it takes people a couple of months to get where they want to go for open old-fashioned surgery. But after our surgery, usually few weeks is all what my patient need. Now,
you're not going to start jogging or nothing, but I mean, you can do your activities and cook and so forth.
You just told me how many blocks you walk now. How many blocks do you walk now?
6 or so, and then I got to
6 or so.
Yeah, I'm trying to make it longer, trying to push myself a little bit.
Yeah, don't try to push yourself too hard.
No.
But from walking 10 feet, now you can walk 6 blocks.
Yeah.
That is, honestly, I would have trouble to walk 6 blocks, and I didn't have your surgery.
Well.
So that's pretty good. I think that's pretty good. Now, any other question or comment? No?
No, except that I would recommend it for anybody that has back pain of any kind like that, and you just don't know where to turn. It really was.
Well, it is we made a big surgery, small surgery, so we can give that option to many more people.
That's good.
Thank you so much for the interview. I appreciate that.
Okay, thank
and
you.
In the sense that hopefully you don't need me anymore, I hope I never see you again.
Okay, well, there is a heaven and hell, I guess.
Yeah, well, yeah. Then you have a good day now, okay?
Okay.